Now, these minerals usually doesn't show any deficiency in a normal person because whatever we take, almost everything, food supplements, they contain small or good amount of zinc. So, zinc deficiency is very rare occasion. Zinc deficiency is very rare occasion. As such, zinc has not so important questions to ask from, but still, as a mineral, you must remember few enzymes where zinc is required, right? So I have put one mnemonic here, SCARWIG. A stands for superoxide dismutase or SOD, carbonic anhydrase. This enzyme is found inside RBC, used for making to solubilize CO2. Alcohol dehydrogenase or aldehyde dehydrogenase are two enzymes which require zinc. Okay. There are many other enzymes. Two enzymes I have mentioned here. Starting with A. RBP or retinol binding protein requires zinc. Wound healing process requires zinc. Wound healing process. Insulin secretion. And taste sensation. Zinc is very important for insulin secretion. It is often supplemented in patients suffering from diabetes mellitus. And gustation is a taste sensation. Now, I stands for insulin secretion. I stands for also immunity. If you can recall, during COVID, people used to be advised to take zinc supplementation for increasing immunity. In many viral infection, zinc is supplemented to increase innate immunity. Okay, that's all. Zinc has nothing to do much. There are a few diseases mentioned in the zinc, but hardly it occurs. Let's have iodine, okay? Iodine is found in seafood, seaweeds, sea fish, sea substances like seashells, oysters. Now, iodine is usually found in the sea bed and the areas near to the sea. Say, for example, the soil around Kolkata city is rich in iodine. Why? Because sea is nearby. But the soil in Birbhum, Bankura, Malda, or the upper districts, northern districts of West Bengal, say for example Darjeeling or Kashi and Kalimpong, that soil is not rich in iodine. Correct? So the food grains grown in that soil doesn't contain iodine. So what happens? The people residing in areas which are farther from the sea surfaces or sea areas, seashore, they do not get iodine from soil. These particular minerals should be taken from the soil. Okay? Iodine. So what we have to do? We have to give fortified table salt for them. Fortified table salt means iodine already added, artificially added iodine containing table salt. If you take salt from the seabed, seawater, that will contain iodine. But if you make salt from rock salt, that may not contain iodine. More chance it will contain magnesium, manganese, but not iodine. Follow? So those salts are fortified with iodine. Now this was seen in China and Japan when they saw that people residing in hilly areas, they are suffering from thyroid diseases, they are suffering from low IQ. When they supplemented iodine to their food, they found that next generation is having better IQ or less thyroid problems. Correct? So they started giving. Later on, it became a habit to fortify salts with iodine. Now, people who are staying near seashore, they do not need fortified salts. They are also started taking same. So people who are residing near the seashore, they started having iodine excess, and people who are residing in the hilly areas, they started getting the sufficient amount of iodine. So again, the thyroid problem started happening in the people who are residing in the seashore areas. Okay. So then the government again sat together and said that these fortification should be must for areas which are farthest from at least 100 kilometers or 200 kilometers away from the seashore. Okay. Fortification is not so necessary in areas which are near to seashore. Okay. That's why nutritionists often advise the people who are residing near seashore to take rock salt instead of common table salt. Why? Because we do not need iodine from that. Understood? These are small tips regarding the iodine. Now, this is probably the only mineral which can be absorbed even through skin. If the individual is having iodine deficiency, then the person may show absorption of iodine through skin. Now you must ask, how is it possible? Who will spread iodine in the air so that the person with iodine deficiency will walk through and get the iodine? Well, nature will do that. How? If you remember the Fukushima accident in Japan, you remember in 2006 or 7, I think it happened, or 12. That atomic power center was there, and there was a tsunami, and the water broke into the power center, the furnace, and it blasted, and all radioactive material were scattered. That was Fukushima disaster is called. So when the reporters, the health professionals, or the engineers who are going to rebuild the place, they started visiting those places, they were given iodine tablets, irrespective of their iodine status. How do we measure iodine status? We measure iodine status by measuring urinary excretion of iodine. We take a small amount of urine and then we measure iodine by atomic absorption spectroscopy. This is a very difficult process, so we do not prescribe a person to measure iodine in urine. Rather, we give iodine If it is sufficient, then it will, excess iodine will create problem much later than iodine deficiency. So, the Fukushima, they started giving these iodine tablets because if those individuals suffer from iodine deficiency and if they walk through those places where radioactive elements are scattered, one of the intermediate of radioactive decay is iodine 131. So at some moment that iodine 131 they will absorb through their skin, right? And that might cause cancer. So to avoid such circumstances, they were given iodine supplementation, iodine tablets. Now, what is it which inhibits iodine absorption? Must remember thiocyanate. Thiocyanate that inhibits iodine absorption as well as iodine transport. Now, these following two these slides are dedicated to biosynthesis of thyroid hormones. Have you studied this biosynthesis of thyroid hormones? Is done? No? Anyone? No? So, thyroid hormones are synthesized in thyroid gland. The gland has two particular histology facts. One is follicles, another is parafollicular space. Right? The follicles are normally squeezed. When they are active, they become swollen, and inside the follicle, the lumen becomes prominent. Right? So, they become follicle, follicular space, and parafollicular space. When the gland is active, there are three segments: follicle, follicular space, and parafollicular space. When the gland is not active, then only two: follicle and parafollicular space. Clear? Now, this follicle has got a single layer of columnar cells, made up of single layer of columnar cells, and that contains a particular protein called thyroglobulin. Thyroglobulin is a glycoprotein. These thyroglobulin are synthesized by follicular cells, and these thyroglobulins contains many or several tyrosine residues. Tyrosine residues. Iodine is efficiently trapped by thyroid gland. Iodine is efficiently trapped by thyroid gland. Wherever you inject iodine in your body, all iodine will accumulate or concentrate near the thyroid. And using this particular process or the notion or concept, we perform a particular test called what? Thyroid scanning. We inject radioactive thyroids and take the relative emission near the thyroid gland. If the gland is very active, it will show red. If the gland is normally active, it will show yellow. If the gland is not active, it will show dark. So, hyperactivity and hyperactivity can be diagnosed. If it is cancer, it will be red, bright red. Okay? So, like this, using this particular property of thyroid gland. Now, the iodine is then oxidized by an enzyme called TPO, thyroid peroxidase. It is a heme-containing membrane-bound protein which oxidizes iodine to I minus, I2 to I minus. This I minus then replaces the OH of tyrosine residue and becomes iodotyrosine. If only one molecule of iodine is added, then become MIT, monoiodotyrosine. If two are added, it becomes diiodotyrosine. It looks like this. See, this is monoiodotyrosine. OH, iodine, OH, iodine, iodine, OH, this. This is tyrosine residue. Now, these and this, when they combine, MIT plus DIT, it becomes T3. When two DIT combines, it becomes T4. T3 DIT plus MIT. T4 DIT plus DIT. When opposite arrangement occurs, means a DIT adds on MIT, it becomes reverse T3. Correct? MIT, DIT, T3. DIT, MIT, RT3 or reverse T3. Clear? These are all thyroid hormones. Among them, T4 is particularly called thyroxine hormone. T4 is called thyroxine hormone. Right? Now, this is regulated by hypothalamo-hypophyseal gland axis. Right? What is the compound which is secreted from hypothalamus? TRH, thyroxine releasing hormone. Correct? Then it stimulates pituitary, adenohypophysis, and then it secretes TSH, which stimulates follicular cells, and then it synthesizes and secretes thyroxine hormones. And these thyroxine hormone then again goes for feedback inhibition to the pituitary gland. Fine. Excretion usually through urine, a small amount can be excreted through bile, which may found in feces. Hey, next slide, Karo. Okay. Now, function of iodine. The classical function of iodine is to prevent goiter. Classical function of iodine is to prevent goiter. You give iodine, goiter will be prevented. If you give more iodine, goiter may aggravate. So, dosage should be given carefully. Right? Now, these are the classical things. Now, there are many non-classical uses of iodine. In some places, it is given in fibrocystic tumor of the breast. It is found it is good. It helps in reducing the tumor. Okay, like that. Many non-classical functions are also there. Just remember this thing only. Okay. So, goiter is more prevalent in women, young women and older women after menopause. Toxicity, as I said, if you give more iodine, then it becomes toxic and it also forms goiter. In selenium, what you need to know, the selenium is found in 21st amino acid as selenocysteine. What is the function of selenium? Selenium acts as an antioxidant. What does it do? It cooperatively helps in the function of vitamin E and vitamin C. Alone selenium is not so important, but it must be associated with vitamin E and vitamin C. Correct? It has a complementary action. Next. Here are a few enzymes where selenium is found. One is thyroidoxine reductase and this glutathione peroxidase. They are all antioxidant enzymes. These are all antioxidant enzymes. Next. Next. Now, this diagram, if you can recall, I gave this diagram in vitamin C. Vitamin C I porilam na. Vitamin E. Porilam na. So, vitamin C, vitamin E and selenium and glutathione. All these four will have single diagram. Role as antioxidant if this question comes for vitamin E, C, selenium and glutathione. All four, this single diagram. Okay? They have sparing effect. Means if selenium is there, proper amount, then you may require a smaller amount of vitamin E or vitamin C. Likewise. Okay? Now, where do you find selenium from? From soil, water, soluble in water. It is good to have selenium in soil. If selenium is absent in the soil and people take those grains, they suffer from a disease due to selenium deficiency called Kishan's disease. From China, after the name of the state or province where it was first found, that particular province soil is deficient in selenium. So, people suffer from a disease called Kishan's disease, mostly dermatitis kind of expression. Recently in India, this state showed what will be the effect of increased selenium. Suddenly, a story came to a reporter that in a village, all the male are shaving their hair. Why? Because they are losing hair, like anything. Okay, very interesting story. So many people started doing what is the work and something like that. Something went wrong. So they found they take the wheat which is given by the government and which is grown in Punjab. And from that state, that region, soil is very rich in selenium. So the food grains contain high level of selenium. Now these people are not accustomed with the high level of selenium in the food. So what happened? They lost their hairs. The full village became bald. Right? Very interesting story. So nothing more is good. Nothing more is good. Suppose you are a practitioner of community medicine and you are posted in Maharashtra, in that particular village by the government. You have to find out what is the reason. Right? You are the person who will point it out. Fluorine, again, it is water soluble. It's found in drinking water mostly. The fluorine, in small amount it is required, very small amount, 1 ppm. Correct? It is good for our health. What for? It makes the teeth stronger. How? When fluoride is oxidized, it forms fluoridate, a compound. Fluoride is reactive, but fluoridate is not. It is inactive or inert. So the upper surface of the teeth react with calcium and fluoride. It forms calcium fluoridate. The calcium fluoridate is very inert substance and tough one. So the upper layer of the teeth is covered with that calcium fluoridate. And whenever we take any acidic food, say pickle or some fruit, so that does not affect any further on the surface of the teeth, because teeth is made up of alkaline metal, calcium phosphate. So if you put acid in calcium phosphate, what will happen? It will break up, you will become calcium carbonate and carbon dioxide. Correct? So the moment you will take a pickle, all teeth will vanish. Did it happen ever? No. Why? Because of the fluorine. People who do not take much care of the fluorine, they suffer from dental decay, dental caries. Say for example, small children, what they are fond of eating? Caramels, candies, sugar. So the sugar, they bring the bacteria. The bacteria ferment on the sugar and they produce acid. They do not brush regularly. Do we? They don't at all. Ask your mother at the age of 3 how easily you used to brush your teeth. So definitely they suffer from dental decay. But when we grow up, that doesn't create a problem. Why? Because the teeth by that time forms a calcium fluoridate coating over the teeth, which is inert to the acid. But if we are very reluctant to our dental health, then definitely it will happen. Excess of fluorine. Now, suppose you are posted in regions of Andhra Pradesh, Telangana now, in district like say Mahbub Nagar, means the regions near the away from the sea. Those means drought hit areas or dry areas. Even some places in Bakura and Purulia, they all suffer from this particular problem because water is found very deep. Correct? That is not a problem. Problem is when we dig up the water from the shallow well. If the water is taken from the very deep, there is not a problem. But problem arises when we dig up from the shallow well. When we take up the water from the earth crust, it forms a vacuum. The ceiling of that space which is to store the water, it gets oxidized. It forms fluoride and arsenic salts which are soluble in water. When water was there, it hardly is to allow oxygen to get it oxidized. But now water is taken up, so now it is vacuum. Now air is there and water is there separately. They cause oxidation of arsenic and fluorine. And this fluorine then gets dissolved with the water. Next time, when you take up the water, you get a lot of fluorine with the water. And if you consume this water for 5 to 6 years or 10 years or more, then you develop certain diseases called genu valgum or fluorosis. It's very difficult. It causes bone deformity, it causes joint immobilization, it causes dental decay, correct? It's all sorts of problems. People cannot walk, means very immature, premature arthritis you can say. 10-year, 12-year-old boy will not be able to walk due to arthritis because all joints are locked. I have seen few cases in my life. If you are posted in those areas, you also see. Correct? So, genu valgum is a disease due to excess of fluorine in the water. Sodium, potassium and chloride and iron. Okay? She will take. You have any questions regarding this portion? Small portion though. Then we discuss the questions, important questions from here. Okay. Number 1. From here, the copper already I have explained in last class. What are the questions to be asked? Wilson's disease you must study. Menkes disease you must study. Wilson's disease you will get as a clinical question. Clinical question you will get. You will get questions like name the compound which chelates copper. What is the compound? D-penicillamine. D-penicillamine. Right? This is a compound which chelates excess of copper. This is used even in case of excess iron. Same compound. Okay. Okay. Next, copper deficiency manifestation, Menkes, copper excess manifestation, Wilson's disease. Both you have to study. Okay. Study the clinical aspects. Study the symptoms. This will be asked as a clinical question, like giving a case study. Alright. Then, name the enzymes which require zinc, which require copper, which require selenium. This kind of question will be asked. Which of the following enzyme contains selenium? Which of the following enzyme does not contain zinc? Like this question you might get. Okay. Copper is very important, although it is this thing, minor mineral, but trace element, but copper is important. Selenium glutathione peroxidase, that pathway, effect as antioxidant, selenium, effect of selenium as antioxidant. This question is important. Rest are not so important. Remember zinc and magnesium, these two are important in diabetes mellitus. So zinc and magnesium you should remember. This is required for zinc is required for insulin secretion and magnesium is required for insulin storage. Right.